Infertility is a condition in which a woman's capacity to become pregnant and give birth is hampered or reduced in some way. Unless you've been trying to get pregnant regularly for at least a year, you probably don't need to see your doctor about infertility. So, when you come, don't forget to hit the button. Subscribe to this channel, it's very important to me. Subscribe to this channel. Don't skip it. Don't go or don't continue reading without subscribing. Also, like this video, share, and leave your comments. Women should talk with a health care provider earlier. However, if they are 35 years or older and have been trying to conceive for 6 months or longer, or they are over 40 years. So if women fall within this category, then they should talk to their healthcare provider. Between her late teens and late 20s, a woman's reproductive years are at their height. Fertility begins to drop about the age of 30. Once you reach your mid-30s, your decline accelerates. Fertility has plummeted to the point where most women will be unable to conceive naturally. That's by the age of 45. The quantity of eggs in a woman's ovaries is fixed from birth. As women become older, their egg count declines. Additionally, older women's surviving eggs are more likely to have 40 chromosomes. And as women get older, they are more likely to develop fertility-threatening conditions like uterine fibroids and endometriosis. You should also talk to your doctor about infertility if you have irregular or absent periods. Ovulation that is irregular or aberrant accounts for 30% to 40% of all cases of infertility. If you have irregular periods, no periods or unusual bleeding, it's likely that you are not ovulating, a condition known as anovulation in medical terms. Although anovulation is commonly treated with fertility medicines, it is vital to be checked for other disorders that may interfere with ovulation, such as thyroid problems or adrenal or pituitary gland abnormalities. You should also see your doctor about the possibility of being infertile if you have very painful periods. Some women have mild periods for a few days, while others have heavy periods and unpleasant cramps on a regular basis. Endometriosis, that's a disorder in which tissues normally located in the womb are found elsewhere in the body, may be prevalent in women who have very heavy, painful periods. You should also see your doctor if you have been diagnosed with pelvic inflammatory disease. PID or pelvic inflammatory disease is a female reproductive organ illness. Every year, more than 1 million women in the United States are diagnosed with PID. Pelvic inflammatory disease arises when germs go up the uterus, ovaries, or fallopian tubes from the vagina and cervix. A fallopian tube or ovarian abscess might result from the infection. If PID is not treated promptly, it can lead to long-term complications. The most common causes of PID are gonorrhea and chlamydia. In a woman, gonorrhea and chlamydia might generate unclear signs or perhaps no symptoms. It might take anywhere from a few days to a few weeks for a woman infected with gonorrhea or chlamydia to develop PID if she is not treated. PID causes 1 out of every 10 women to become infertile. Scarring of the fallopian tubes can occur as a result of PID. This scarring can obstruct the tubes, making it impossible to fertilize an egg. PID scarring can potentially prevent a fertilized egg from entering the uterus. It can instead start to grow in the fallopian tube. The tube has the potential to rupture or to break, resulting in life-threatening bleeding in the abdomen and pelvic. You should also see your doctor about the possibility of infertility if you have undergone treatment for cancer. A tumor in or near another reproductive organ, such as the ovary or fallopian tube, or the uterus or cervix, may require surgery. A tumor in neighboring abdominal or pelvic organs, such as the colon, rectum, or anus, may also require surgery. Some cancers occur near the neurological system, such as the brain or spinal cord. These procedures may have an impact on a woman's fertility. High-energy rays are used in radiation treatments to eliminate cancer cells. Radiation aimed at or near a woman's reproductive organs can have an impact on her fertility. Also, radiation targeted at or near the ovaries causes enough damage to impair their function. Even if the radiation isn't directly directed at the ovaries, the rays can be absorbed and cause damage. The ovaries absorb a large amount of radiation when it is focused inside the vaginal canal. Radiation to the uterus can result in scarring, which reduces uterine elasticity and blood flow. It also prevents the uterus from expanding to its full size during pregnancy. These issues can impair the uterus' ability to develop and expand during pregnancy. Women who have received uterine radiation are more likely to experience miscarriages, babies with low birth weight, and babies born prematurely. Thank you very much for watching, and continue to subscribe, like, share, comment on our videos. Don't forget, the subscription is very important, so subscribe now.